I'll start.
I'm ready.
Okay. Um, okay, that's that. Hello, all. This is RJ Ashmita. Welcome back to a new event. I hope everybody's having a great time. So today we'll be discussing about eating disorder. So I guess we all must have been known about this disorder, but we are not that much familiar with what it is. So it's basically a condition with an unhealthy relationship with food. Well, speaking about unhealthy relationship with food, I'm not sure with an unhealthy, but I know I have a really good relationship with food. So, being a VITN and a day scholar, I know how hard it is to sit in Gymkhana and seeing Annas carrying tandoori in their hand. And when you look back to your lunchbox, you can actually see Sambar rice saying hi to you. Well, I think it's a really sad part from my side. Well, let's get back to the session and ask the expert. So by this, I invite our guest speaker. We have Ms. Chaitali Sharma, who is pursuing BA Psychology Honors from Lady Shri Ram College for Women, Delhi University. She has interned in the field of psychology with Dr. Prerna Kohli, who is a President Award-winning psychologist of India. So the agenda on which Ms. Chaitali would be educating us is anxiety and its factors. It's a great pleasure to have you on board. Please welcome Ms. Chaitali Sharma. Welcome, ma'am. How are you?
Thank you so much. I'm great. It's a pleasure to be here today. How are you?
Yeah, I'm doing perfectly fine. So I hope this will be a very interactive session. I have asked, I hope really people ask it with tricks and doubts in the comment box down there. Okay, ma'am, I think it's all yours. Please carry on.
Okay, thank you so much. So, the topic of discussion for today is going to be eating disorders. So, I personally feel like eating disorders used to be a very anglicized concept, but now it has actually merged its feet in India as well, and it's really affecting teenagers and especially young adolescents. So it's basically called Feeding and Eating Disorders in the Diagnostic and Statistical Manual of Mental Disorders in its latest version, that is DSM-5. So what it means is that it represents a group of complex mental health conditions that can seriously impair health and social functioning. Because of the physical nature of their defining symptoms, eating disorder can cause both emotional distress and significant medical complications. And the saddest part is that they are mostly found in young adolescents, and yet their mortality rate is the highest among any mental disorders.
Okay, ma'am. So, well, asking about this, I have a small doubt. We all know, like, women, we ourselves like dressing up, thinking about our body, how we feel, how we talk, how we walk, how we present ourselves. Well,
Yeah.
do you really think that it's a myth that mostly women have this disorder, or is it the same for men as well?
See, if you look at facts, most of the mental disorders that have been recognized by the APA, that is the American Psychology Association, most of those disorders happen more in women. Now, if we take the case of this particular disorder, the thing is that it affects women in worse ways. It's not like it happens only in women, it happens across all genders, but it affects men in different and less, what do I say, less serious ways, but it really affects women because I feel like we have more stringent beauty standards for women than we have for men. So that is why it is seen more in women. However, that's not true that it only happens in women. Eating disorders can happen to anyone from any gender.
Okay, okay. So it's common, like it's a very common one. But I think we don't have like people don't give much importance to this disorder. Like it's like a daily routine, right?
Yes, so the thing is, the disorder, why the disorder is not very common is again what you just mentioned, because we don't realize how serious it is. The reason why, okay, one perspective would be ki, like people in India, they don't have so many problems related to their body, so that is why they don't have the disorder. But another perception could be that we are not aware enough to get it diagnosed, that there could be a lot of girls and boys and non-binaries who are not able to eat food, who are not able to, feed themselves as much as they want to because of the expectations that the society puts on us and the certain beauty standards that we have to meet. So that's a very major factor that this disorder is not common in India. One of the major reasons for that is the awareness that people don't know only that if something like this is happening, it's actually a problem that needs to be treated.
Yes.
Plus,
Okay, ma'am. Then
it's upon diagnosis as well. So, for diagnosis, you have to visit a psychologist, and that can only happen once you are yourself, you know what problem you're facing, that you have a certain issue that needs to be fixed. It's very difficult to find out. You are just not eating food because you feel bad about yourself. It's not like people are doing it deliberately. It's just their mind convincing themselves that no, you should not eat, or you should just, purge out, or you should keep eating to deal with anxiety. So I think awareness is very important so that in case you have any symptoms, you can visit a professional for them.
okay. Okay, then I'm towards the chubbier side, so I personally spend a lot of time thinking about my body too. So I just want to ask you something, like if if I have this disorder and I'm coming to you as a patient, and what will be the first advice that you'll give to me, like mentally, emotionally?
The first advice that I'll give to you is stop putting yourself on a spectrum, that this is the chubbier side, this is the thinner side. I honestly feel, and it is right. It's the first wrong step that we take is we put ourselves on a measuring scale. The day
Mm-hmm.
we stop doing that, half of the problems will be solved. It's not how your body looks, it's more about how your body feels. It should feel healthy. The point is to feed healthy things into your body and not be a thin body or like what they call a fat body. Those are just standards that we have made according to our own perceptions. What may be on the chubbier side for you, maybe on the thinner side for someone else. So, what's the standard? How do you decide this standard? You decide that standard for yourself. And that standard should be of treating your body right, not making it look right. Because what is looking right? There can never be any looking right. Plus, as far as this disorder is concerned, it's a very serious disorder. In many cases, this is like having the disorder is a very extreme result of body shaming and self consciousness. It could also be, just not feeling confident about yourself or not being able to wear certain kind of clothes because you don't feel confident enough about yourself, or you can't really, talk to people if you're in a social setting because you're always too preoccupied with how you are looking or how people think you're looking. So I think the first step is to accept ourselves that okay, however I look, I just have to keep myself healthy. And it's a very big thing to do. It doesn't happen overnight. You just can't tell yourself that, okay, this is the thing. If it was that easy, then I think we won't have any such disorders. But it's the first step is to accept ourselves that, okay, whatever is happening, I love myself. And it's a gradual process. It takes time. But the first step is the most difficult and the most important one. Now, for the disorder, for the first thing that is required is for the disorder to be diagnosed. Now, this disorder has proper like imaging, you have to go through physical examinations, then you have to meet a physician as well. Apart from a mental health counselor, you'll have to meet a physician as well, who will tell you that this is your body weight, this is your BMI, if you're healthy or not. And then after that, there are certain psychological tests as well, like there are questionnaires, to figure out whether or not you have the disorder. See, sometimes we have problems. We can't eat food because we feel really bad about our body. That doesn't necessarily mean that you have the disorder as well. Having the disorder is a very serious condition. So that can only be diagnosed through proper tests and after that. But before the diagnosis, if there is a diagnosis, a positive diagnosis of the disorder, then we have to see that what kind of disorder it is, because there are different types of eating disorders that have been mentioned in the DSM-5. So once we have made the inference that what kind of disorder the person has, we can start the treatment according to that. It consists of therapy, then it consists of medicines, there's cognitive behavioral therapy, there are self-help techniques to, again, what I said, to feel better, to be more accepting of your own body. Because essentially, if we think, why do we try to make these changes to ourselves? Why do we want to look thin? To fit in, right? To be accepted by people, to be called pretty. But why is it so important to be called pretty by others? And until and unless you yourself think that, okay, however I'm looking, it's beautiful, even if 100 people tell you that you're looking absolutely gorgeous, you won't be able to accept it. So, whether or not you have the disorder, the first step towards growth is self acceptance. And it's a very difficult and a long process, but I don't think it's an impossible one.
Definitely, ma'am, definitely. Well, I think some of the main criticizing things comes from our family. Well,
Mhm.
being in my family, whenever I go to my native, they be like, "Why are you like?" Every time I go there while eating, they used to say to me, "Okay, yeah, you have your genetics, so just control, just control." Do you think the same? Like, families play a major part, right?
They definitely do, especially I feel in Indian societies, body shaming is a very casual part of our conversations and the type of circles that we sit in, be it friends and especially family. They mention it very casually. And the saddest part is that that is something that happens on so many levels that we cannot change it overnight. It will take years to actually make people aware. Because on the other hand, I also feel that you can't really blame them. They don't ever stop to think that whatever they are saying, how is it affecting the person that they're saying it to. And so many times they are saying it to like 16, 17-year-old kids whose entire world is how they look. So when you're making comments on how someone's body looks or how much acne they have on their face, it becomes very difficult to get over that. But again, we come back to that one point. You can't stop your relatives overnight. And it also takes a lot of courage to, speak against them, to retaliate that no, what you're saying is wrong. So, in order to help ourselves, again, it is important to reassure yourself that what I am doing, these people don't know how many struggles I go through with my body every day. Plus, your body does so many things for you. Your body does so many amazing things for you. If we sit down and we think of all the amazing mechanisms that just happen inside our body and we are not grateful about them, we don't realize how much we owe to our bodies for being so healthy, for helping us get out of the bed every day, for making us feel the way we do. And it's okay. It is impossible that every day you will feel equally beautiful about yourself. But somewhere that voice inside your head is also important, that every time somebody tries to tell you that the way you are looking is not good enough, the voice inside your head at least reminds you that no, they don't know, they can't tell me. Who are they to tell me? And once you yourself are convinced enough, one day you'll gather the courage to ask the other person that who are you to tell me. And mostly the worst part is mostly these relatives commenting on the kids' bodies in the family aren't very healthy themselves.
Definitely, we can say aunties, uncles.
Exactly. So, I mean, if you think rationally and logically, then why would you take what they say into consideration? It's just that at that point we are so vulnerable. We ourselves are so conscious ki this is how we look. Oh, our family members are also saying this. But after that, if you take a step back and you sit down and think that okay, whose words am I taking seriously? Who are they to tell me? Look at them. And
Exactly.
that is the case with everyone, even if it is your closest of friends. Nobody can ever set the standard for you that this is the way you should be looking or this is the way you should be dressing up. You decide that path for yourself. If you yourself consciously want that, okay, I want to be thin or I want to be thinner in order to feel better about myself, then there's also healthy ways of doing it. You can exercise, and exercising is very good for your body. It's very healthy. No matter how your body is, exercising and moving your body is definitely very important. So whatever you do, it's important to do it for yourself and not what your family members may be saying or what your friends may be saying. It is to keep your body healthy and not to make it look good to others' eyes. It should look good to your eyes. It should feel good to you and not your family members who will just sit there, say something, and forget about it later.
Yes, ma'am, definitely. So I have another question. So, what is the most serious eating disorder?
Okay, so the most serious eating disorders, I'll mention three of them. So there's binge eating disorder, there's bulimia nervosa, and there's anorexia nervosa. So in binge eating, what happens is it's the most recently recognized eating disorder, and it is the most common. It is characterized by repeated episodes of binge eating, defined as the consumption of a large amount of food accompanied by a feeling of loss of control. It is found in higher rates among people of larger body size. Now, again, see, it is important to know about these disorders, but it is also important to keep in mind that these disorders require proper diagnosis. All of us engage in like binge eating sometimes. You're feeling too anxious, so instead of having one tub of ice cream, we had two. And there's nothing abnormal with that. That's totally all right, completely all right. When it happens very frequently and it causes distress and impairment in the social functioning of the individual, that's when it becomes problematic. Any kind of, and whenever we talk about any kind of mental health disorders, be it anxiety, be it something as common as anxiety or something like eating disorders, they only become they are natural phenomena. They happen to everyone. Even feeling conscious about your body, it happens to the best of people. When I say best of people, it means celebrities, even the people who are set, who sell their bodies, whose whole personality is about how they look. Even they get very conscious about their body, and they do have serious eating disorders. Eating disorders are the most common in models. So that
Mm.
is when it becomes a disorder, when it causes physical impairment, it causes mental impairment, that even though you know that this is ruining your body, but you just can't stop yourself from eating every day. So that is binge eating disorder. Then the next one that we talk about is bulimia nervosa. So it involves recurrent episodes of binge eating followed by compensatory behaviors or designed to make up for those calories. So now this is a very serious one. Okay. So now what happens in this disorder? You eat a lot of food. You can't control yourself from eating that food. So instead, what you do, you try to compensate it. That, okay, now I have eaten so much. So there are actually models who eat food and then make themselves vomit. So that whatever food they have eaten, it gets out of their system. It doesn't remain in their system. They do excessive exercising just to get rid of that food that they've put in their body. It causes mental distress to them that, okay, I've eaten this much, now I have to take it out of my system. It gets so serious that people get sick, but they still can't get over the fact that I have put food in my body and I need to get it out of my system. Obviously, these are extreme cases. There are milder cases as well when like people eat food and they get even if they don't want to vomit, they get the sudden urge of vomiting. that as soon as you eat your food, it's not even conscious. It could be below your conscious awareness that as soon as you eat food, you want to vomit or you want to do excessive exercising because your mind is telling you without you consciously being aware of it. Then the last one is anorexia nervosa. Again, very common. It is characterized by the restricted intake of food, leading to a lower than expected body weight, fear of weight gain, and disturbance in body image. Many people are unaware that nervosa can also be diagnosed in individuals with larger bodies. So, what happens is see, however, our body looks, it depends on a lot of factors like our genes, and how our body frame is. That is why the first thing that I mentioned was it's very wrong to try and put yourself on a spectrum, that this is on the larger side and this is on the smaller side, or this is on the chubbier side. It's unfair to put yourself on a spectrum or a scale, because again, the essential part of it is that you're comparing yourself, and that is wrong in its very sense. So what happens in anorexia nervosa is, the first thing is you compare yourself to others, and because of that you restrict. Even though you feel hungry, you don't eat food. You restrict your eating just to fit into a particular body shape. And see, dieting and everything, it's not unhealthy as long as it's keeping your body energetic. You're feeding your body what it needs to be fed with. You're consulting with a proper dietitian or a gym trainer who is telling you that, okay, this is the amount of food that you're supposed to take in order to get the energy that your body requires and the outcome that you need. That's a healthy way of doing it. But doing it like this, that you're just vomiting the food that you're eating, and even though you're feeling hungry, you're forcibly stopping yourself from eating, that no, I am not going to eat because it's going to make me look fat. And it's a great myth that anorexia nervosa only happens to people, who are like very thin. It's so many times it happens to people who think that their bodies are large, so they want to make themselves fit into that particular frame, that okay, this is a petite frame, I want to get into that. So no matter how hungry they feel, they stop themselves. It's very serious. People go through extreme anxiety just to stop themselves from eating food. They spend like 2 3 days trying just to avoid eating food. Why? Because they want to fit into this particular category, that okay, that they don't even realize. The most important thing to see here is the people who are suffering from such disorders, they have come such a long way in thinking themselves into these things that they don't realize where they stemmed from. So they can't really go back on it in one day. They can't just tell themselves that, okay, from today onwards, I love my body and now I can eat all the food that I want. If it was that easy, then I guess we wouldn't need mental health experts in the field. So when people come so far into their mind that the condition becomes a disorder that they cannot go back from, that's when you need the help of a mental health practitioner to remind you of the things, to make you see that where is it exactly it stemmed from, and how irrational it could be. Like you mentioned that so many times your family members say things like that to you. So, in order to realize that, okay, maybe the things that my family said to me or the things that my friends said to me have made me so conscious about myself, have made me think this way about my own body. But all of that requires you to sit down and think calmly. But when someone is so deep into this pit of this self consciousness, that they don't understand the sources where it came from. It just exists in such a huge quantity inside them now that it becomes very difficult to overcome it. So that's how a mental health professional can help you then, that they help you in figuring out the reasons, that okay, this is where it came from, this is what your relatives say, but how does their opinion matter? Even if your friends say so, even if they continue to say it so, why does it matter so much to you? You ask yourself such questions, that all right, even if my best friend is saying this, and maybe some kind of introspection is needed, maybe you're not treating your body right. Just having a eating disorder and not eating anything is not treating your is definitely not treating your body right. But at the same time, eating junk every day and not taking care of body is again not treating your body right. So if your best friend is telling you that, you should start eating healthier foods so that you don't fall ill so much, it's not so much as body shaming. They're not trying to drag you down, but it's you who decides the boundaries, that this is what I can hear and this is what I cannot hear. This is what you can tell me and this is what you cannot tell me. Because at the end of the day, all that matters is how comfortable you are with yourself. And that cannot be done until you do these introspections. You ask yourselves these questions, that this is how I want to look. This is how I, this is this, these are the steps I want to take. You can do even research that if, like, some people do want to get into a thinner body, they want to build muscles. So you can find constructive ways of doing it. You don't have to punish your body to look a certain way. You can do it by rewarding your body also, doing exercises and like eating healthy food, fruits, vegetables. It's not punishing your body. It's rewarding your body. It's feeding good things into it, treating it like a temple. That's the right way of doing things. But hating yourself for the way you look and, taking unconstructive, distressing, impairing ways of achieving that goal, that is what is a problem. That is what should be prevented. And if it happens, then it should be fixed.
Okay. So I think I really needed to hear this. Well, I think it was very personal to me. I think it'll help so many people who's watching this video. Well, I just wanted to ask another thing. We have seen athletes, right? Like we don't like for normal people, okay, fine, but for finding this disorder in athletes, I think it's a challenge, right? What do you think about it? Like in athletes?
I think in athletes, this disorder is still less common. It is more common in people from the film and fashion industry. Because again, for athletes, it's very important to keep their body healthy. So they work
Mm.
out a lot. They are very conscious about the food they're eating. They're very conscious about treating their body right, not making it look right. That's not their first concern. Their first concern is to make the body feel right, to make it function properly. Athletes treat their bodies like temples. This disorder is more common in people like models and
Mm.
actors, because for them looking perfect is very important. When your whole career depends on how you look, it's only inevitable to, get disorders like this. Not everybody gets it. Any disorder that you get, any mental disorder, there are a lot of factors at play for that, and a major role is played. See, there are two things that make you susceptible to a disorder. It's your genetics and the environment that you are in. So your genetics are, the your inheritance, the type of genes that your parents have given you. All of us have genetics, and those genetics are often responsible in causing different disorders or make you susceptible to different disorders. Now, the environment that you are in, how people treat you, the type of experiences that you had. Now, when some people who are like, they get child body shaming and bullying experiences at a very young age, like when they're 13, 14, at that time, you don't even realize what is happening to you, but those experiences, they stay with you. They linger around for so long. When people who are so important to you, so close to you, like your family members, when they say things about the way you look, it stays with you for very long. And especially in people like models, they just have to make sure that they look good. So that is why it is very common in models and actors. But I don't think it's all that common in athletes, because again, athletes have to treat their body right.
Yes, definitely. So can you see some symptoms? Like if my friend is suffering from this and I have to like give her some awareness, like I should find out now. So is
Yeah.
there any symptoms?
Sure. So there is a lot of symptoms. See, again, if it's your friend, then even talking to them can help you get to know a lot of things, a lot of insight on why they are doing what they are doing, in order to see a few symptoms. Like if you see that maybe the things that my friend is saying or the activities that she's indulging in look a little risky. So these are the few uh, symptoms that you can look for, like dietary restriction, frequent weight changes, or being significantly underweight. negative body image, presence of binge eating, presence of excessive exercise that can, actually do harm to the other person instead, and presence of purging, laxative, or diuretic use. So, in anorexia, people even take medicines to get the food out of their system. They are called laxatives. So, you take those medicines and you instantly vomit. So, if you see that if some of your friends or anyone around you is doing things like that, then that is definitely a problem. That is definitely could be a disorder and probably is. So, the first thing that you should do is try and seek mental health help for them. Then there is excessive thoughts surrounding food, body image, and weight. You can clearly see the difference. Again, I mentioned earlier that somewhere, somehow, everybody is conscious about the way they look, but the people who have this disorder or who might soon develop this disorder, they are just too preoccupied with how they look, their body image, and how their body is looking, and that's the only thing that's running in their mind all the time. So I think that's the first sign, especially when you're looking for it in a friend. That's the first sign you can see that. And maybe it can even help to barge in, intervene at the very initial steps. That if you see that your friend has become excessively conscious, suddenly excessively conscious about their body, you can intervene at the very first step, because in treatment for these disorders, the early the intervention happens, the early the person get helps, the better it is for them. The longer it takes, the more serious the disorder gets. So if you see that for like a month, your friend has been just too conscious about her body, always thinks about her body image, too conscious about what she is eating, and is adapting unhealthy ways of dealing with those thoughts, then you should actually sit and talk to them, because a lot of times the thoughts in our head, they are too mingled together. And if you put them out to someone else, and especially when it's a confidant, it's a close friend, or maybe it's your partner, then those things start making more sense to you as well. You don't necessarily have to tell them anything that, okay, you should love your body or things like that, because you're probably not qualified enough to judge the degree of seriousness in the
Mm.
person's condition. So sometimes just, sitting and listening to the other person and talking to someone else becomes very helpful, because then you yourself are able to see things clearer. So try and talk to these friends about how they're feeling. Why is it that they're feeling that way? Try to help them in ways, you feel that you can help them by being a friend. It's very important to be a friend to people that you think are having problems, and not a therapist or a counselor or a guide, because
Definitely.
friends are the first social support that you need. Friends are a very important component of the kind of image the person has about themselves, and they are the first component of the social support that a person has. And especially when we are talking about students who are going to college or who are in school, for them, what their friends think about them is extremely important. So that is there. And again, one more preventive measure is kindness to yourself. Not indulge in certain things. Even we don't realize that sometimes the comments that we make very jokingly on the other person can really make them feel bad about themselves. Even if they don't show it, then later it becomes very destructive for the other person. So it's very important to be kind to everyone around you, to not pass comments on anybody's body. It's not just, we blame others that, okay, people do this, people do that, without realizing that we also engage in that kind of tasks every now and then. That we comment on somebody's skin color, or we comment on somebody's body type, or even how much someone eats or how less someone eats. You never know what kind of problem they are going through, why they're eating as much they are eating. And see, when you're younger, you don't realize how these things affect someone else. So I think growing up, when you get to know about these disorders and how immensely they can affect someone, it's very important to be mindful of the things that you say to anyone, be it your best friend, because the people that you're closest to, your words matter the most to them. So even though you're saying something in a very joking manner, it can actually make them think about it 10 times a day. So it's very important to be also conscious about the things that you are feeding into the other person's mind. Because at the end of the day, we are a part of this society, but we are also building this society. So what we do really brings a change in how perceptions are set.
Definitely. So, do you think like the generation now, that is our generation, we're speaking out much more like when compared to the other generation?
I think we have become very vocal about like issues like body shaming, and we have become aware of these things. And see, that is the first step, the awareness. Now, how we deal with it, how it shapes up in the future, that we'll get to know, I think, 5, 10 years down the lane. But definitely, I feel like it's better than the previous generations because at least now we know that what we say, how it might affect someone. The fact that you and I, we are sitting here having this conversation, and so many people are going to hear this conversation, is a first step. It's a good thing that our generation is doing, but there is still a long way to go. We can't stop here. We can only go forward from here.
Definitely. It was a great time speaking to you, ma'am. Thank you so much. I think it's a very informative session, and I really hope many of us really get good knowledge about from this meet that we had today. Thank you for coming and joining our part. Thank you so
I,
much, ma'am.
it was very enjoyable for me too. I hope whatever conversations we had is helpful to each one of you. Thank you so much for having me here.
Thank you, ma'am. Thank
Thank
you.
you. Bye bye.
Bye bye. Is it done? Like, can I